Hi everyone, Haley here. Today we'll be talking about bipolar disorder, and I have Chrissy here, my fellow dental hygienist, and we'll kind of be going over the oral hygiene considerations when seeing a patient with bipolar disorder.
Yep.
How are you today, Chrissy?
Good. Thanks for having me.
Of course. So I guess one of the first questions I have is, what are some of the oral conditions you can expect to see with somebody with bipolar disorder?
Yeah, so with bipolar, they have two different phases, and I'll just talk about the different phases because they're fairly opposite. So with their manic phase, often, sometimes during that phase, they have a lot of energy, a lot of creative energy. Anyway, sometimes they will brush with a lot of vigor and have some abrasions and their gums will be irritated. They also could have xerostomia from the different medications they take, which is drier mouth, not as much saliva production, and that can cause things like caries and decay. They could have dyschizia. One of the medications that they take is lithium, and so that affects that. Just some inflammation in their mouth, their tongue, their gums. Sometimes there's a loss of taste, and they might just mention that. I know that's kind of standard. And then some dizziness as well. So just be careful as they're getting up and down from the chair.
There's a specific medication that causes the xerostomia?
Well, it's a side effect of a few of them, but the antidepressants definitely cause it.
So
sometimes
that's something to look out for sure.
Mm-hmm. Yeah. So one thing that you'll want to do as a hygienist is talk to the doctor beforehand, or at least get their medical history and know what medications they're taking and what side effects the medications have specifically. Okay.
And is there any modifications that you can recommend to the patient about xerostomia?
Yeah. There's a few different things that they can do. There's dry mouth toothpaste, there's gels, there's lozenges, there's a rinse. So all of those things, of course, just drinking water too helps.
Okay. And would you recommend like an in-office or at-home fluoride application used to prevent the dental caries as well from the xerostomia?
Yeah, absolutely.
Okay.
Absolutely. That will help strengthen their teeth. Yep. So there's a number. I mean, if it's to the point that they're getting just a lot of cavities, you might even want to get a prescription fluoride toothpaste or a prescription. You can get trays made and put a prescription kind of fluoride gel in every night.
Okay. And then speaking of rinses, I think I read something about a rinse that you could use to help with the reduction of bacteria in the periodontal disease. Do you remember the name of that?
Yeah, so the chlorhexidine, and that will often be prescribed just to kind of help the bacteria and then just kind of help arrest
very good
problems, but you do want to make sure that you don't use it for too long because it can stain their teeth. So it would be kind of a short-term application. And then my last question about the oral conditions for the patients with bipolar disorder is, when they are brushing their teeth too vigorously and they're causing abrasion, what kind of modifications to home care do you recommend? Yeah, so I would, when they're there, you can kind of show them, tell them, and watch how they brush, and then make modifications. Okay. We recommend a soft bristle toothbrush at a 45-degree angle towards their gums. Okay. Whether it's up or down. And then, just a back and forth motion.
Okay, very nice. And then the last topic we're going to talk about today is kind of how do treatment differ from patients that have bipolar disorder? So what kind of treatment management considerations would you do at the appointment?
Okay, yeah, thanks. That's good to think about. So in their manic phase, they may be really talkative, distractible, and maybe a little irritable. So kind of just watch for that. In the depressive phase, they'll be more lethargic. They won't care as much about daily activities like brushing and such. So either way, it's good to just kind of keep things simple. One
like
goal
in your
at a
instructions.
time.
Okay.
Yeah.
And then is it important to keep the area in the office kind of clutter-free to keep distractions down?
Yeah.
Okay.
Yeah. Okay. I think especially in their manic phase, that'll be nice to have just a calm environment.
Okay. Well, I think that's all the questions I have about the oral conditions of a bipolar patient. So thank you for coming in today and answering those questions for me.
Yeah, thanks for having me.